Hi, I'm Caroline Linde, and I'm the CEO for Laerdal Global Health. Many of you are probably familiar with this baby, the NeoNatalie, that has been used to train over 1 million health workers globally. NeoNatalie was born in 2008, and since that, we've learned a lot about how health workers train best. That's why we're here today, to introduce you to a new and smarter NeoNatalie, the NeoNatalie Live. And to start off this session, it's a pleasure to welcome Laerdal Global Health's chairman, who will also be stepping in for me while I'm on maternity leave.
Yes.
Ingrid Laerdal, heartily welcome.
Thank you, Caroline. And hello to all of you, and thanks for joining in today. We have been much looking forward to this day and to share together with all of you the official launch of NeoNatalie Live. As many of you know, birth asphyxia is one of the leading causes of early neonatal mortality. Every year, approximately 900,000 babies die because they're not breathing at birth, and another 1 million are misclassified as fresh stillborn, although they have a heart activity during labor and could have been resuscitated after birth. But we also know that birth attendants that are trained in and equipped for basic newborn resuscitation can save most of these babies, and there is a tremendous save potential. In 2008, we were invited by our long-standing partner, American Academy of Pediatrics, to develop a basic newborn resuscitation program that came to be the Helping Babies Breathe program. We developed the first generation NeoNatalie that you saw Caroline carried specifically for this program. It was water-filled, affordable, and most importantly, it enabled peer-led simulation-based training and hands-on training in the most remote and rural areas of the world. In 5 years, the program scaled to more than 80 countries and led to significant improvements. In Tanzania, they saw a 47% reduction in newborn mortality and 24% reduction in fresh stillbirth. But together with our partners, we also learned a lot from the extensive research that followed the program and saw that there could be opportunities to help make an even bigger and more sustained impact to help save more lives. And that is what led to the development of NeoNatalie Live. You will hear more about the insights that informed the development of NeoNatalie Live a bit later in the program by Øystein and others, but I can share with you that this simulator has been tested and been part of research in many, many programs around the world already. In over 8 years, it's been tested in Tanzania, Nepal, Democratic Republic of Congo, Kenya, Nigeria, Norway, the US, so both low and high income settings. And close to 100,000 training sessions and more than 7,000 team training sessions have already been completed on this system. And it's also part of the Safer Birth Bundle of Care program that's scaling up in Tanzania that you'll hear more about from Dr. Mendo and Jenny later in the program. So, although we are officially launching NeoNatalie Live today, it's truly a simulator that's been tested and developed over many years, and we believe she is now ready to be part of many newborn resuscitation programs and help birth attendants around the world save more lives.
Okay, hold it, there you go, there you go. Okay, take a break, take a break. You got it, keep the noise in. I know. Yeah. Well,
things we did, we tried stimulated, checked airways, stick to skin, temperature. I think there was a bit more in between. Want to try it again?
yeah, sure, that would be great. Baby, you're not talking. We get some yogis on.
Good teamwork. Yeah. Thank you, Ingrid, for that background. We hope you enjoyed the film. Now, in order to understand more on why and how NeoNatalie was made, I would like to welcome Eystein. Eystein is a researcher and product developer here at Laerdal, and you've been with NeoNatalie live since conception.
Yes. Thank you, Carolina. We started to develop NeoNatalie Live back in 2015. Then we invited a group of midwives and doctors from Tanzania to come to visit us at Laerdal to discuss different possible solutions on how we could help improving newborn survival. Even though newborn care programs already had shown significant impact when implemented in low-resource settings, there was still room for improvement when it came to survival rates of babies born asphyxiated and in need of ventilation. Therefore, we started a clinical study where we recorded ventilation data and videos from newborn resuscitation at Haydom Lutheran Hospital in Tanzania to learn what was really happening during these first critical minutes after birth. After having studied more than 1,200 resuscitation cases, we learned 4 important things. 1. Ventilation of the newborns was initiated too late. Even though all the midwives had learned about the golden minute, almost no babies were ventilated within that golden minute. And there was little awareness about how quickly 1 minute really passes. Therefore, we saw the need for developing a training system that would allow for practicing effective performance of the steps taught in international guidelines for treatment of non-breathing newborns. A second thing we learned. Ventilations were not given continuously. We could see in the video recordings that ventilations were interrupted with a lot of suction and stimulation. They would typically just give a few puffs of air, followed by stimulation and excessive suction. Therefore, we wanted to make a trainer that would give the learner confidence in the fact that uninterrupted, continuous ventilations is good and effective for the non-breathing newborns. 3. Newborns are often much more difficult to ventilate than any newborn training mannequin currently on the market. Asphyxiated newborns may have fluid-filled lungs that are stiff and difficult to ventilate initially. When you begin to ventilate, you may see no response to your ventilations. Even if you do everything correctly, you see no chest rise. That often leads to the belief that there is some kind of obstruction in the airway, again, leading to the earlier mentioned excessive suction. But other training mannequins would show chest rise immediately when you try to ventilate. And that is not the case in real life. This is why we created a mannequin that better simulates real asphyxiated babies. And with this, allowing for practicing different patient cases with different difficulties and challenges in the ventilation. A fourth thing we learned was that the newborn's heart rate was not actively being used to measure the condition of the newborn or the effectiveness of the resuscitation. With NeoNatalie Live, you will therefore get a display of the heart rate in the app. The purpose of this is to make the learner better understand the important relationship between ventilation and the development of the heart rate. NeoNatalie Live also allows you to use NeoBeat, our easy-to-use heart rate meter that provides an accurate and continuous display of a newborn's heart rate. NeoBeat works just as well on the mannequin as it does on a real baby. The mannequin gives a heart rate development and lung response based on clinical data from the more than 1,200 actual resuscitation cases from the study. We also learned that there often is limited access to competent instructors who can conduct trainings and assess and correct learners' ventilation technique. Therefore, we made the mannequin automatically measure how it is being treated. And we developed the app that gives the learner objective feedback on what to improve and how to improve it. Currently, with the help of our partners, more than 100,000 training sessions have been performed. Many of these have been part of different research projects around the world, and you will be able to read more about that in our white paper that will be sent out after the webinar. So today, NeoNatalie Live is officially born. The development did take a bit longer than a normal pregnancy. With that, I would like to hand it back to Caroline.
Thank you, Eystein, and thankfully, this pregnancy is much shorter. If you have any questions, please add them to the chat and we'll try to answer as many as possible. Thank you, Eystein. The development of this innovation could not have been done without our partners. So to all of you who have been involved, thank you for your time, your effort, and your valuable feedback so that we could make NeoNatalie Live a reality. Today, we're actually lucky to have some of these partners with us. And first, from Tanzania, I would like to welcome Dr. Pascal Mdo, the medical director at Haydn Lutheran Hospital.
I am Dr. Pascal Francis Mdoe from Haydn Lutheran Hospital. I'm an obstetrician and a gynecologist from this hospital and also a researcher. Me and my colleagues here at the hospital, we were privileged to take part in the development and testing of the first prototype of the NeoNatalie Live. The engineers and developers, they approached us and asked us to contribute based on our experience in the clinical setting to make the new simulator more fit for clinical use. So we contributed and they took our ideas into account and they developed the first prototype of the NeoNatalie Live. After completion of the development, they brought the NeoNatalie Live to Haydn, the first prototype in 2017. And me with my colleagues at the labor ward for our hospital, we took part in testing the first prototype. So we installed the first prototype in our labor ward, and the midwives were trained on how they can log in and do the individual training. After 3 months of installation of the NeoNatalie Live in our labor wards, the midwife used to train on their own time. So when we went back and analyzed the data, we found that every month, at least each midwife trained 17 times. So in average, each midwife used to train at least 17 times. That was a significant number of training they did in the first 6 months. When we further analyzed, we compared the training and also the clinical outcome. We found that the number of babies who were ventilated has increased, but also the number of survivors have increased significantly. And we wondered why. We went back and asked them, some of them we asked in the individual interviews, we asked them, we see there is a significant change, but also we see that you have been trained a lot. And what made you train a lot and what made these changes that we see? They told us that they were very much fond of the NeoNatalie Live. They liked it very much. And they liked the training because it was individual training and with immediate feedback. Furthermore, they told us through the training, they managed also to improve their skills, but also become more confident when facing a little baby. And that's why I've improved even their practice when they face a little baby. So this means that the NeoNatalie Live has helped us in this hospital to save more babies and to build more confidence among our healthcare providers, but also to retain their skills on bag and mask ventilation. So NeoNatalie Live to us is a very good simulator for simulation bag and mask ventilation in this hospital.
Thank you so much, Dr. Mdo. In the studio here today, I also have with me Mai-Sissel Vadla, who's a physician and a PhD student at the University of Stavanger. And you're actually doing your PhD study on the use of NeoNatalie Live in Tanzania, in Haydom.
That's right, Carolina.
We're really excited to hear about your study.
Thank you. My PhD is part of the Safer Births research group, and from 2016 to 2018, we conducted a study using NeoNatalie Live for simulation-based training at Haydom. The hospital serves a catchment area of approximately 2 million people. The labor ward has 3,000 to 3,500 births annually, and it is the midwives who are responsible for the births and also for most of the newborn resuscitations. It was the midwives at labor ward who were the study participants in this study. And due to a high staff turnover, the number of participants varied throughout the study from 17 to 28. So in September 2016, NeoNatalie Live was implemented at labor ward at Haydom. The mannequin was placed in situ at the ward, easily accessible for the midwives to use during their busy working shifts. Since the mannequin provides automated feedback on the action points in the Helping Babies Breathe algorithm, it was possible for the midwives to train by themselves and still receive crucial feedback on their performance. During the first year of the study, the mannequin was used for self-guided individual skill training, and the approximately 20 midwives at the ward conducted 700 trainings during this period. After this period of self-guided training, the management at the hospital appointed 4 dedicated midwives as local champions. The tasks of the local champions were to encourage their colleagues for training and also to ensure an all-time functioning mannequin. After 1 year of local champions leading the training, these midwives conducted 8,500 trainings at this very busy labor ward. We also looked at the staff participation in training, and we found an increase from 43 to 74% of the midwives participating in training each month. In addition, we measured the training performance, and we tracked the frequency of trainings performed without errors. When you conduct a session without errors on this mannequin, you receive the feedback "well done." And after the impressive increase in training frequency, we saw an increase in trainings receiving the sessions "well done" from 75 to 92%. So our conclusion is that it is possible to achieve really high frequent training, even with high staff turnover and a demanding resource setting. And we do think that using local champions when implementing simulation-based training increases the chances of success.
That's just amazing, Mai-Sissel. And thank you so much for sharing these findings from your first study. If you have any questions also to this study, please remember to put them in the chat. And we will now move over to another partner, the American Academy of Pediatrics, who's been working with the local pediatric societies to test NeoNatalie Live in Bangladesh and Nigeria.
Hi everyone, my name is Dr. Mercy Raymond, member Pediatric Association of Nigeria and master trainer for the GATES AAP project. The NeoNatalie Live was tested using remote training for participants, where participants were involved in the low dose, high frequency sessions where they practice neonatal resuscitation skills using the NeoNatalie Live. The value of the NeoNatalie Live in this project was that it provides feedback to the participants and help them to track and evaluate themselves how they have made progress with regards to their practice of neonatal resuscitation. As for the participants, it's a new experience they are having with the NeoNatalie Live, because previously we used the NeoNatalie Regular, which does not provide live feedback. And then for the trainer, one is able to track how the participants are faring with regards to their practice sessions. Going forward, the NeoNatalie Live is going to change the practice of neonatal resuscitation and the skills that participants will learn, because it provides live feedback, and then it can be used to remotely train participants, especially in resource-limited settings like Nigeria.
Hi, Dr. Miriam. It's good to see you again and work with you again for this Laerdal project. I'm Dr. Leah Harris, and I'm speaking to you actually from Djibouti, but I wanted to reconnect with you since we first met in 2019 in Cox's Bazar to do a then Helping Babies Breathe training, and have subsequently been invited to work with the American Academy of Pediatrics and Laerdal to do a pilot project on the ENC Now, Essential Newborn Care Now, using NeoNatalie Live, which was within this last year. We had the opportunity to work with our prior master trainers to have them teach the course on the NeoNatalie Live using the ENC Now website to a new group of midwives that work in the Rohingya refugee camp in Cox's Bazar. And I'm really excited to catch up with you on how things went.
Hi, Dr. Harris. It's really great connecting with you again.
So I'm super curious because for this project, I was the TA and was working from Canada and had the opportunity to see you use all of these tools. I'm super curious to know how our master trainers and how the participants found the use of the NeoNatalie.
I feel was a great addition to the training because it gave the participants an opportunity to get feedback on their resuscitation efforts. So the new mannequin, for example, would give feedback on the proper positioning of the head and the effectiveness of the breaths delivered, the ventilation breaths that were being delivered. It would give the participants an idea about the heart rate and the response of the baby to the resuscitation efforts. And then the participants could use all of that information and the feedback to really refine their skills. The NeoNatalie Live mannequin, compared with the traditional NeoNatalie mannequins, for example, have come with built-in case scenarios, which simulate different degrees of severity of newborn resuscitation. So we were able to integrate, for example, in the golden minute, a case which simulated a simple case of resuscitation, and in the continued ventilation portion of the training, we had a scenario which simulated a more difficult resuscitation. So
that sounds awesome. How did you think that they did in the follow-up low-dose high-frequency practices?
Able to get the feedback information on their mobile phones using the application and the NeoNatalie Live mannequins. So they could, for example, follow how quickly the mannequin responded in terms of the heart rate or the effectiveness of their breaths. And they could see that feedback information on the mobile application. Our master trainers did an excellent job of integrating them into the pre-course assessments as well as the post-course assessments.
That's great. It really seems like all of this new technology has revolutionized the delivery of the essential newborn care education to the midwives who serve the Rohingya refugee camp in Cox's Bazar. Only one thing I hope is that all of this technology doesn't prevent us from meeting in person again at some point to work together again.
Absolutely agree. I hope to see you soon.
Thank you, Dr. Harris, Dr. Miriam, and Dr. Mercy Raymond. It's always so inspiring to hear directly from the field. Next, we will hear from Jennifer Gilbertson, our Impact and Implementation Director here at Laerdal. And you are going to share even more on how NeoNatalie Live can be implemented.
Thank you, Carolina. And as you've gathered from the earlier presentations from my colleagues and our partners, NeoNatalie Live has the potential to empower teams and individuals to improve their care and confidence. We see NeoNatalie Live as an important step to building quality improvement systems where healthcare providers train based off of their individual competency needs and the needs of the team. If you have a look at the app, you will see that you get the option to do either individual practice or group practice. If we choose individual practice, and we then turn on the mannequin, I'll give it a second to make sure that the mannequin can now connect with the app via Bluetooth. Great, connected. Now I'm going to scroll down and find myself as a learner. And now that I'm in, I have the opportunity to either do ventilation practice, where I could be just practicing on my ventilation skills and the pace of ventilation, or I can choose one of these patient case scenarios with variable heart and lung cases. You know, as we heard before, the training algorithm and these different patient cases are actually based off of 1,200 recorded newborn resuscitations. That means that these cases reflect the reality of resuscitation so that the providers are prepared when it comes time to work with real patients. So let's choose the first patient case. When I start ventilations, you'll see that the timer will start. As Oystein mentioned earlier, the app also measures heart rate. So if you're ventilating successfully, the heart rate will start to rise, as I'm seeing now, and eventually, hopefully, the baby will start crying. As I'm progressing, I can be looking at the heart rate and the time, but of course I can also be looking at the baby. Am I getting chest rise? Do I need to adjust my grip or the tilt of my head? Oh, good. The baby's crying. Okay, so now what I see here on the screen is I get feedback on my performance, as well as tips for how to improve further. So I can open up my ventilation details, and I can see, oh, my ventilation rate was definitely too fast sometimes. And I can look at my head extension, and I can also look at my ventilations and the heart rate throughout the case. I can then go back and decide, do I want to repeat and practice this case again, or do I want to say that I'm done? The idea is that this enables healthcare workers to conduct frequent, short, and targeted training sessions that fit their schedule and needs. Studies show that low-dose, high-frequency training approach effectively transfers knowledge and skills into improved clinical care. Great, now that we're finished with individual practice, let's go over to group practice. Similarly, I need to make sure that the app connects with the mannequin. And now that it's connected, this time I don't just choose myself, but I also choose the team members that I'm going to run a scenario with. So let's choose maybe 3 of us who are going to have different roles. And also I will make sure to choose myself because I'll be the one who's going to monitor the scenario. Great. So similar to what we had in the individual practice, I can choose within resuscitation practice 4 different patient case scenarios with similar situations to the ones we had for the individual. But in addition, we also have some essential newborn care scenarios where you can actually go through the entire steps in essential newborn care, including I can start, and you can see that as the team is running the scenario, I can actually check, and as they do, different steps. Great. So let me tell you actually a little bit about somewhere that NeoNatalie is being used today. And that's this as part of the Safer Births bundle of care, which is being scaled up in Tanzania. Here, NeoNatalie Live is being bundled together with some of our other products that have been developed through the Safer Births research partnership with Haydn Lutheran Hospital in Tanzania. The data from these clinical and training products are then used to identify areas for improvement, leading to small but sustainable changes in care at the facility level and at the team level. As of today, I'm really happy to share that the Safer Births bundle of care has been introduced to 30 facilities in Tanzania and will soon be scaled up to an additional 110. Now, for NeoNatalie Live to create the impact that we envision, it will take all of us. And we hope that you choose to integrate NeoNatalie Live into your newborn training programs, into your partnerships, and we need your feedback when you do. And with that, I'm going to close and hand it back over to Carolina. Thank you.
Thank you, Jenny. I've seen there's a lot of questions coming into the chat, and I will need you here in the studio to answer some of them, but also to bring back Eystein, because we got some technical questions as well. So let's start with them. Can the NeoNatalie Live be used on all smart devices?
Yes, it can be used on a tablet like this or a smartphone, as long as they run on iOS or Android. They also need to have Bluetooth connectivity. But remember, you don't need any of these devices to do proper training on this mannequin, because all the physiological models, everything it does is programmed within the mannequin itself. So you can choose patient case, you will get the baby cry and the responses, except from the feedback that you would need some kind of device to get.
And how much is the app?
It's for free. It can be downloaded from Google Play or App Store.
How is it recommended to train with NeoNatalie Live?
Well, I mean, NeoNatalie Live was really created, I think, to support low-dose, high-frequency training. Really kind of been thinking about, like, how do we make training as easy as possible, decrease the barrier, so that just like in a facility, you as an individual can train on this. You could also use the cases that we were showing here as well. But another, I think, really important use case that we didn't really get into in the demonstration is the idea of peer-to-peer training. So I'm really thinking here like a pre-service educational context, like midwifery schools, nursing schools, medical schools, where you can evaluate each other and go through these checklists together as a way to kind of, have that peer-to-peer learning.
And I know we've been through this, but it's important to repeat. Are you able to get the heart rate with NeoNatalie Live?
Yes, you are. NeoNatalie Live will show the heart rate on the app, but it also can be used with NeoBeat that will actually measure the heart rate when you put it on around the torso, just as you would on a real baby. But you won't be able to palpate on this mannequin.
And does the NeoBeat come with the NeoNatalie Live?
No, it doesn't. NeoNatalie Live consists of the mannequin itself and the mentioned app, but you can buy NeoBeat separately, as you can with a bag and with a device for the app.
Another important question, how long does the battery last?
The battery in the mannequin will last for about 40 hours when it's fully charged. Of course, after years, that will be a little bit smaller, but still it will be plenty of battery capacity to run your scenarios.
You mentioned quite a bit on the group trainings, but how many can you be in one of these group trainings?
That depends. I mean, I'd say in general, since this is a newborn resuscitation scenario, try to reflect what you would do in your actual facility. So maybe have like one person who is the lead, maybe have a support person there. It's important for the group practice that you have somebody who can kind of do the checklist. So whilst the scenario is going, to be able to support the team. But yeah, I think it really, I'd say it depends on what is a natural setup in your facility, because the important thing is being able to replicate and practice as a team the communication, to be able to go through the checklist, making sure that you're confident on the skills, but also how you work together.
Another technical question for you, Øystein. How were the patient cases developed?
Yes, the patient cases that are programmed into this mannequin, they are actually taken from the clinical data that we got out from the study we did with more than 1,200 actual resuscitation cases. And in addition to that, as mentioned earlier, there have been several studies using this mannequin, and one of them, Dr. Jana Heinz at the University of Stavanger, ran a study which showed that simulations on the mannequin are similar to clinical conditions experienced during real newborn resuscitation. She did that at the Stavanger University Hospital.
Coming on to the final question, where can I find information on how to set up and use NeoNatalie Live?
Yeah, when you get your NeoNatalie, there will be instructions for use in the box, but that also exists in an electronic form on our website. We also have a lot of instructional videos too on like basic questions and how to use the product. So yeah, I would say go over to laerdalglobalhealth.com, and there's just going to be a wealth of information, also research. So yeah.
Thank you so much, Øystein and Jenny. And that's everything we have time for today. If you have any more questions, please continue to ask them in the chat, and we'll try to answer as many of them as possible. And also check out, as Jenny said, our product pages for more information on NeoNatalie Live, laerdalglobalhealth.com. And thank you so much for joining us today.